So this entity of an anomalous pulmonary artery arising from the aorta is labeled as hemitruncus. It's an exceedingly rare condition diagnosed in around 0.1% of all congenital heart diseases. It carries a very high morbidity and mortality rate unless it is surgically treated during infancy. As many as 30% of the patients may die during the first 3 months if not diagnosed and acted upon. The RPA is more commonly anomalous, as was found in our case, versus the left pulmonary artery. It arises from the posterior aspect of the ascending aorta very close to the aortic valve. And the left pulmonary artery anomaly is usually associated with a right-sided aortic arch. This entity can be associated with a patent ductus arteriosus, tetralogy, aortopulmonary window, ASD, ischemic hypoplasia, or an interrupted aortic arch. Left hemitruncus is more commonly seen with tetralogy of Fowler than is right hemitruncus. It may also be associated with the DiGeorge syndrome. In our patient, the only association that we were able to find was a PTA, which was associated with a right to left shunt. So in our patient, since the LPA was arising from the RV, the entire systemic circulation was being directed to the LPA, and as a result, there was progressive pulmonary hypertension in the left lung. And in the right pulmonary artery, since it was arising from the ascending aorta, it was receiving all the transmitted systemic pressure, and that led to progressive pulmonary hypertension in the right lung. The first surgical correction of this entity was done in the year 1961. Since then, several surgical techniques have come up, of which direct implantation is the procedure of choice as it avoids re-interventions. There may be complete intracardiac repair if associated TOF is present, and PA banding may be a good option in adult patients with severe pulmonary artery hypertension where other options are not available. So a case series was done by Garg et al. Of 17 patients. They took all these patients with anomalous pulmonary artery and classified them into 2 groups depending upon the pulmonary blood flow, whether it was increased or decreased. So patients with increased pulmonary blood flow had features of heart failure and presented early in their lives with severe pulmonary artery hypertension, and such patients had a bad prognosis since they developed rapid progression of symptoms and needed early diagnosis and treatment. And patients with decreased pulmonary blood flow were the patients who had associated RVOT obstruction. So they tended to present late and more chances of survival into adulthood, and treatment options for them were also better as compared to the first group. So I found 2 cases of adult patients with anomalous pulmonary arteries who underwent treatment. So 36 years old male patient with TOF and anomalous right pulmonary artery who went complete intracardiac repair and was doing well at 6 months of follow-up. And another case that was described was of a 41-year-old female. She's probably the oldest reported patient of this case. 41-year-old female with anomalous right pulmonary artery, severe PH, and intermittent SVT. So SVT ablation and RPA banding was attempted for this patient. After RPA banding, the RPA pressures were found to be reduced, and the patient was also clinically improved at 6 months following this procedure. So the authors of this case report suggested that PA banding can be a good option for adult patients with severe pulmonary artery hypertension where other complex surgeries are difficult. And since the irreversible pulmonary artery hypertension inevitably happens, the ultimate treatment for most patients remains a heart-lung transplant. So our patient had a very high PVR and was deemed inoperable and was referred for complete heart-lung transplant. However, patient did not return to us for follow-up, so we do not know the ultimate fate of the patient. There is one reported case in which hemitruncus has been reported with a normal pulmonary artery pressure. So this is a case that was reported in 2014 of a 19-year-old boy with anomalous left pulmonary artery, and he had normal pressures in the RV and the normally connected RPA. And that case was not associated with any structural defect other than the right aortic arch. So according to the authors, this is the only reported case of this anomaly with a normal pressure in the RV and the normally connected pulmonary artery. This image does not belong to this patient. However, just for discussion's sake, this is how a short axis view of this case would look like, in which the aorta is giving rise to the right pulmonary artery and the main pulmonary artery is giving rise to the left pulmonary artery. So to conclude, idiopathic PH may actually be another very rare disease that we have not been able to diagnose due to lack of knowledge, one of which is hemitruncus. Severe pulmonary hypertension is found in this entity, which rapidly becomes irreversible and is found in both the lung beds. Survival of such patients into adulthood is exceedingly rare, which is why knowledge and early recognition of such patients is very important. To the best of our knowledge, after thorough literature search, I was able to find 15 reported cases of hemitruncus in adults. Thank you.